Hi, my name is Tommy Thompson, and I'm the Executive Director at the Wisconsin Women's Health Foundation. It is my honor to assist in the recognition and celebration of the Champions in Women's Health Awards. The Wisconsin Women's Health Foundation's mission is to innovate, impact, and improve women's health. The Champion Awards are a unique opportunity to seek out individuals who represent our mission and have demonstrated dedication to women's health through outstanding achievement in their specific field. Just as past award winners have devoted themselves to improving the lives of Wisconsin women and families, this year is no exception. Our 5 chosen awardees are all accomplished health leaders and extraordinary examples of what it means to be a women's health champion. At the Foundation, we connect women and families to health resources and provide programs in all 72 counties of Wisconsin. We serve over 7,500 individuals annually, and our work would not be possible without partnering with talented health leaders in our state, like the very individuals we are honoring here today. So let's get started. I'm so excited for you to learn more about these amazing champions. Dr. Jenny Hackforth-Jones served as an obstetrician-gynecologist at Associated Physicians in Madison since 1986. She retired in February of 2020 after 34 years of practice. Dr. Hackforth-Jones, who prefers to be called Dr. Jenny, has been board certified with the American Board of Obstetrics and Gynecology since 1987 and is a Life Fellow of the American College of Obstetricians and Gynecologists. She has served as a clinical adjunct associate professor in the Department of Obstetrics and Gynecology at the University of Wisconsin School of Medicine and Public Health. Through this position, she worked with residents and medical students and believes she taught sensitivity and respect to those in training. Through her general practice in OBGYN, Dr. Jenny has known many patients through adolescence, marriage, and childbirth. She has been able to help women through trauma, divorce, and menopause, and into the later years. Dr. Jenny has a passion for reproductive health care. In recent years, she has returned to work at one of the clinics in Madison. Dr. Jenny continues this since retirement and states that she adores her fellow workers at the clinic.
I came over to America in 1973 to go to graduate school, having got a degree in zoology. I went to Costa Rica to do field work, chasing lizards around, and it came to me that what I needed to do was something to help people, to work with people. The women's movement was pretty strong, and so there was this feeling that I needed to do something for women. I had done some work at Planned Parenthood washing speculums, and that was when I decided that OBGYN was going to be for me. My name is Jenny Hackforth-Jones, otherwise known as Dr. Jenny, and I'm a champion in women's health. I think the most rewarding parts of working in women's health have been and are making a difference in people's lives. I very passionately believe that women should be getting medical care, whoever you are, wherever you're from. I mean, I've loved my career. I've had an amazing career. It was coming at a time when I'm retiring, so it was time to look back over my life and take stock of what I've done and what I've loved. And when I was notified of this award, I was absolutely thrilled, humbled, honored. I would like to thank the nurses at the hospital, the nurses at the clinic, and particularly my primary nurse who was with me for 30 years, Lynn Bagan, and my partners, including the multi-specialty group partners, and then, of course, the family. My husband, always supportive, and my 2 wonderful girls.
Dr. Mollie Kane is an assistant professor at the University of Wisconsin-Madison Department of Pediatrics and a physician at Access Community Health Center. She also takes care of the youth in the Dane County Juvenile Detention Center. Dr. Kane received her medical degree and master's in public health from Tufts University. She completed her fellowship in adolescent medicine and residency in family medicine at the University of Michigan. Dr. Kane has developed an interest in working on issues involving victims of sex trafficking, both clinically and from a policy point of view. She has served on state government committees working on sex trafficking, as well as being involved with multidisciplinary community organizations focused on this issue. She has lectured extensively on the subject. Dr. Kane also has an interest in caring for juveniles and adults who have been incarcerated. Working as the adolescent medicine physician at the Dane County Juvenile Detention Center and as a family medicine physician at Access Community Health Center, Mollie has a special interest in caring for female sex workers and has developed a reputation as a local expert in this area. Along with caring for her patients, she volunteers her time to develop and gives talks to educate others on human trafficking and how we can offer those patients better care. Dr. Kane has dedicated her career to caring for women facing some of the most difficult situations in our country. During medical school, she won the Albert Schweitzer Award for Community Service. During her residency in family medicine at the University of Michigan, she started working at the Corner Health Center, a clinic targeting patients with low socioeconomic status and pregnant and parenting teenage girls. And she continued working there both as a clinician and the medical director after she completed her residency. As a faculty member at the University of Michigan, she founded and served as the medical director for the East Middle School Wellness Center, a school-based health center serving patients of lower socioeconomic status. Dr. Kane moved to Madison in 2002 and started working as the adolescent medicine physician at UW Health at the University Station Clinic. She then moved to Access Community Health Centers in 2005, and at that time also took over responsibility for caring for inmates at the Dane County Juvenile Detention Center under the Department of Pediatrics of UW Health. In her current position caring for patients at both Access and Detention, she cares for a significant number of female sex workers. These patients deal with issues including sexually transmitted diseases, homelessness, violence, addiction, mental illness, and poverty. Dr. Kane develops very strong relationships with these patients, often supporting them when she sees them in jail and then again at Access when they transition to life in the community. Dr. Kane has had patients who have thrived under her care, including one of them who now works at DAYS, the Domestic Abuse Intervention Services. Dr. Kane found out about that when she went to court to follow and support another patient and ran into her former patient there, working 4 days. Dr. Kane also provides medication-assisted treatment for opiate addiction to better serve the needs of her patients. The local community recognizes Dr. Kane as an expert in the area of female sex workers and sex trafficking, as she has given numerous talks on the subject in both academic settings at the University of Wisconsin School of Medicine and Public Health, as well in public settings. Along with the talks about sex trafficking, she has given grand rounds on the care of the incarcerated patient and the unique difficulties physicians face when caring for these patients. She remains a strong advocate for those patients with the most limited support systems. Dr. Kane, in her role as family physician and adolescent medicine physician, has personally impacted the lives of numerous female sex workers in Dane County. These girls and women get referred to her because of her interest and expertise in caring for this population of women. Because of her unique position working as both the primary physician at the Dane County Juvenile Detention Center and as a family doctor at Access Community Health Centers, Dr. Kane can see teenage girls when they are in jail, then follow them after they get released. Many of these girls have more than one stay in jail, and they have the opportunity to have continuity of care with Dr. Kane, both in jail and in the community. Dr. Kane also cares for the remainder of the inmates at detention as well, both boys and girls. And she cares for adult women sex workers at Access. Dr. Kane has educated other physicians in training as well as interested public officials in human trafficking, including its local effects. Human trafficking has been appropriately getting more recognition as a major public health problem, and Dr. Kane volunteers her time to disseminate information related to both her personal experience as well as reviewing the literature regarding local and national policies. She has the unique position to merge both the academic and political aspects of human trafficking with her own strong clinical experiences. Dr. Megan Moreno is a professor of pediatrics and an affiliate professor of educational psychology at the University of Wisconsin-Madison. She is the vice chair of digital health for the Department of Pediatrics and a division chief for general pediatrics and adolescent medicine. Dr. Moreno is principal investigator of the Social, Media, and Adolescent Health Research Team, SMART. Her research focuses on the intersection of technology and adolescent health. Dr. Moreno and her research team focuses on 3 core research areas. First, the innovative approaches to adolescent health using social media. Second, internet safety. And third, measuring technology use and misuse. SMART's work includes several research programs, including the Technology and Adolescent Mental Wellness Program, the Summer Research Scholars Program, and 2 youth advisory boards. Dr. Moreno serves as an international expert on the intersection of adolescent health and technology. Her work has contributed to clinical updates and policy recommendations. Dr. Moreno's work also includes a focus on advancing women in science. She is the co-author of the book Women Rock Science and co-teaches the UW's yearly class, Women in Leadership in Science, Engineering, and Medicine.
My initial training was in pediatrics. What I realized was that it was really the adolescent and even the young adult population that really inspired me. And they are at a point in their lives where they're developing their own health behaviors and making their own decisions that will help them be strong and healthy and connected. That's an incredible privilege as a physician to be part of that journey. I'm Dr. Megan Moreno. I'm an adolescent medicine physician and researcher at the University of Wisconsin-Madison, and I'm a champion in women's health. I would like to thank my nominators for this award, especially Jennifer Krug. I also feel very grateful to have had many women leaders in leadership positions for my career. And so for me, receiving this award and being able to share that news with my dad before he passed is one of the really meaningful things for me in the end part of his journey with us as a family. The most rewarding part of working in women's health for me is that as an academic pediatrician, I get to pull in multiple types of work to support women's health. So I can go to clinic, I can serve my patients, I can hear their stories, and also in my role as a teacher, I get to teach in clinic and bring learners and people that I hope will go on to better serve their patients because of the experience they had in our clinic. One thing I'll mention that I and my research team spend a lot of time thinking about is representation in science and how important that is. And all of those things help us ask questions in really different ways. When I think about the future of women's health in Wisconsin, some of my goals and aspirations are to provide training experiences that can inspire others to follow the path of improving women's health. And so we provide internships starting at the level of high school and going all the way through undergraduates, graduate students, medical students. And so I feel really inspired by that work and thinking about what women's health will look like 10 years from now, and feel so fortunate that I was part of the training experiences of those folks who are now doing that really important work of improving women's health.
Rosa Zibell is native of Spain. In 2001, she followed her family members and immigrated to Wisconsin. Through the 20 years since her arrival in this country, she has mastered English and completed her formal health care education. During that time, she has established a critical place in the Waukesha County healthcare community. She serves as a leader in working to develop responses to community health issues. Her work began as a volunteer interpreter at St. Joseph Medical Clinic. She continued her education, completing the licensed practice nursing program, followed by obtaining her associate's degree in the nursing program, both from Waukesha County Technical College. Finally, in 2013, she completed her Bachelor of Science in Nursing degree from Chamberlain University in Downers Grove, Illinois. For the last 15 years, she has been an employee of the Waukesha Free Clinic. Currently, she is responsible for the nursing oversight of all clinics, including diabetes, smoking cessation, general health issues, podiatry, OBGYN, and in development of the Hispanic women's health and wellness. While the clinics are a cross-section of the population served, it is noted that 62% of the patients seen in the general clinics are female. In recent years, the clinic has been part of the Healthier Communities grant led by the Medical College of Wisconsin. Rosa served as the nurse navigator, working with the vulnerable Hispanic population, assisting them to obtain the necessary tools to make a difference in their own lives. In addition to Rosa's work in the clinic, she is engaged as a community nurse educator for Grapevine. Marquette University College of Nursing also taps Rosa's unique background in having her assist student nurses in their mentoring program. Her work for the last 15 years as a community nurse in a free clinic, through innovative evidence-based practice and a patient-centered philosophy of care, assistance to empower the neediest population in the actual healthcare system, and to advocate constantly for women's right to well-being regardless of their race, color, religion, gender, or national origin, has changed the community where she works in a very positive way. In the word of Miss Zibell's nominator, the characteristics that make Rosa a champion include her dedication to her patients and her community. She has lived in Waukesha County for over 18 years and has worked at the clinic for over 15 years. She started at the clinic as a volunteer translator and currently serves as clinical operations coordinator. What stands out about Rosa is her relationship within her community. She works full-time at the clinic, but above that, she volunteers to work with the impoverished families by providing education on empowerment and self-sufficiency. She was creative and innovative when developing our behavioral health support groups, one in English and one in Spanish. Rosa, in the last few years, has developed not only the behavioral health group, but also a wellness support program and a smoking cessation program. She is always looking for ways to support the needs identified by our community assessment program. The assessment program is a gathering of many community advocates and local hospitals who meet annually to address issues that are current in our community. Rosa is intimately involved in providing advocacy for the neediest in the female Hispanic community. One example of her dedication to her patients is the time a critical lab result came in on a female patient. The patient needed to be notified so she could obtain more medical care. Rosa called, left messages, and the patient was not returning any of her calls. Rosa drove over to the patient's house and requested to speak with the patient and was able to convince her to navigate the complex medical system. Rosa is an individual who has many years of experience and expertise in working with an impoverished population. She cares for the vulnerable and at-risk individuals in our community without bias or judgment. Rosa has created a culture of trust and respect in our clinic. Rosa is bilingual, speaking both English and Spanish. The Hispanic patients have a special relationship with Rosa and our team because of the environment that she has created in our clinic. The voices of our patients are heard and the needs are met. We have for numerous years been graded as exceeds expectations by the United Way of Milwaukee and Waukesha County. All our care is provided free of charge at the clinic. We have over 50+ volunteers that work with Rosa and express their gratitude with working with one of the best nurses. We are so fortunate to have Rosa on our team and do not underestimate the impact she has had on our patients and on our community. Overall, Rosa is one of those special and unique individuals who creates a healthy and healing environment for the community. Dr. Sam Poore received his MD and PhD degrees from Brown University in Providence, Rhode Island, and completed his residency in plastic and reconstructive surgery at the University of Wisconsin-Madison. He then did a fellowship in microsurgery and research at the Bernard O'Brien Institute of Microsurgery in Melbourne, Australia. Dr. Poore specializes in microvascular surgery with an emphasis on breast reconstruction, as well as general plastic and reconstructive surgery, including reconstruction of the hand and lower extremity. He is the Chief of Plastic and Reconstructive Surgery at the William S. Middleton Veterans Administration Hospital and is the President of the Midwest Society of Plastic Surgeons. Since 2012, Dr. Poore's research group is either a principal investigator or co-investigator, has earned research funding through the Defense Advanced Research Project Administration, the National Institutes of Health, the Department of Defense, and the U.S. Department of Veterans Affairs, on projects ranging from peripheral nerve regeneration, neural engineering, prosthetic development, and vascular engineering. He has published over 60 papers in the primary literature on topics ranging from bird flight to breast reconstruction, and edited the textbook Extremity Transplantation, a comprehensive clinical guide. He is actively involved with international surgical relief organizations, providing plastic and reconstructive surgical care and education in Vietnam and Nicaragua.
My name is Dr. Samuel Poore, and I'm an associate professor of plastic and reconstructive surgery at the University of Wisconsin, and I'm a champion of women's health. I ended up taking a biology class from a professor there at Northern Arizona University who was an amazing professor, and he inspired me. I was kind of waffling about whether I wanted to go to medical school or do something else, and I was just continued to be inspired by him, and then decided to pursue an MD and a PhD degree and work in his lab for my PhD. When women are diagnosed with breast cancer, or they find out that they have a very high chance of getting breast cancer, they're in an incredibly whirlwind state. Their lives are just immediately uprooted. Really almost a lifetime sort of relationship. And the rewards of knowing patients on that level is truly, it moves me to want to keep doing it. Rebuilding the breast, it represents closure for them. And for that reason, I really like to be involved in the process. The issue of accessibility and breast reconstruction has been discussed at national meetings and conferences and papers for 20 years. I really want one of the messages from this to be that we can figure out a way to make it work if you need to see somebody, even if it's a phone call at first. The exciting thing about the future is I think that it's going to continue to become more of a accessible option for women because it's so important. There's so many people to thank, but I would really like to thank the staff in the clinic. It's a team. It's got to be a team. Really, I want to thank them. And then the residents are incredible. They're an incredible part of this process. They take care of the patients. They see them at 5:30, 6 in the morning. Without them, we would not be able to do this. My partners, Dr. Michelotti, Brett Michelotti, people who deserve the most thanks are the real heroes, which are the patients. And it's been a privilege in my career to be able to take care of you. So thank you.
The Champion in Women's Health Award highlights the importance of dedication to community and is a testament to the unique role each of us plays in the health and well-being of women and families in our state. Each year, it is our goal to highlight individuals who have made a difference. They have been trailblazers and role models for others to follow. They help achieve our vision of a healthier Wisconsin. We are so grateful to be able to practice this tradition of recognizing our health leaders. It has been our privilege to have this opportunity to commemorate and thank them for their continued commitment to innovate, impact, and improve women's health. Thank you.